It's Dr. John Oltean from Shoreline Vision, and I'm showing today a LASIK video. This procedure is called Intralase with custom LASIK. What you're watching right now is what's called the applanation cone, which is pressing on the front surface of the cornea, and this is the process by which we make the cornea flap. We've got good applanation to the cornea, and the wave you see going forward is actually tiny spots being made by the laser, approximately 130 microns of depth into the cornea, and this is what we use to construct what's called the corneal flap. You'll see the little ring illumination there, and that is the final part of making the flap, which is making what we call the side cut. So we basically have 130 micron cornea flap that has now just been constructed, and at this point we've removed the applanation cone and we'll be moving over towards the actual laser treatment. We have just moved the patient from the Intralase laser, and they are now underneath the excimer laser, and we've placed protective drapes over the eyelashes, and at this point an eyelid speculum is being placed in order to hold the eyelids open during the actual treatment. You will notice a few red spots on the white of the eye, and that's just a few broken blood vessels from the previously made corneal flap treatment. Right now we're aligning things. You can see two purple dots along the horizon there, and that's for alignment of the eye. And this circular mark is made so that when we lift the flap and then put it back, we have some reference points. So you can see we now have the flap constructed. This instrument will be used to get underneath just a small portion of the cornea flap that was previously made, just getting a start to get underneath it. And the other side of the instrument is now being placed beneath the flap, and will kind of loosen some of the adhesions so that we could lift the flap. The eye, of course, is completely numb, and there's really no feeling or sensation to this procedure. The patient notices just the light kind of moving around, and that's just about it. So now that we've gone completely under the flap, we lift it and kind of tuck it back and out of the way, and we have an approximately 8.9 millimeter corneal flap, which allows a nice area for the actual excimer laser treatment, which is actually what we use to correct the refractive error or need for glasses or contact. The lights have now been turned down, and the laser we use has a tracker on it and also what's called iris recognition software, so that we can be sure that we have everything perfectly aligned from the previous measurements that were made in the office setting. This usually takes a few minutes to get the laser locked in, and once that's locked in, using a foot pedal, I'll begin the actual laser treatment, and you can actually see that being started at this time. Kind of the flashing lights that you're seeing there is the actual excimer laser doing the treatment on the exposed corneal surface. The treatment time varies. This was an approximately 25-second treatment that can last anywhere from 15 seconds up to a minute or more. Now that the treatment is completed, the next process is placing the corneal flap back into position. We first moisten the surface and then just flip that flap back into position, washing out any debris that might be still there. We're just about done with the procedure. The next step is going to be smoothing the cornea flap and making sure all the fluid is out from underneath the flap, and we utilize a soft sponge to do this. This is the first process in the healing of the flap, and we just want to make sure it's nice and smooth and any fluid is out from beneath. You may notice the ring on the center of the cornea, and that's actually the light from the laser microscope. You can see a nice round ring, which means that all the astigmatism has been treated. Right now I'm just testing to make sure that the flap is nice and secure. The next step is placing some antibiotic and anti-inflammatory drops, as well as a nice thick drop to keep everything smooth. At this point the procedure is completed. The eyelid speculum, which held the eyelids open, is removed. And if the patient is having the other eye treated, we would do a similar procedure with the other eye. Thank you for your attention. I hope you enjoyed this LASIK video from Shoreline Vision.